Good afternoon, everybody, to the last seminar before Reading Week, which I'm sure everyone's looking forward to. It's my pleasure to introduce Melanie Fortune, who is a visiting scientist with the Partnership for Work Health and Safety here at UBC School of Population and Public Health. She's also a research associate at the Institute for Work and Health in Toronto, Ontario. An epidemiologist by training, Melanie completed her Master's of Public Health at the University of Toronto following her undergraduate studies in environmental and health sciences. She contributes to the environmental and occupational health fields as a researcher and a program evaluator. So welcome, Melanie.
Thank you, Sarah. It's absolutely my pleasure to be here and speak to you today on Valentine's Day, the last day before Reading Week at many universities. I'm so pleased to see so many people in the room, as well as those here in line to talk about a topic that I'm quite passionate about. So before I continue on into any of the really juicy details, I feel it's really important to acknowledge others who've contributed to the material I'm going to present to you today. I'd like to acknowledge Cam Mustard, who was the supervisor of my work during my master's research, as well as Patrick Brown, who's a very talented biostatistician with Cancer Care Ontario. And without his advice, some of the later work I'm presenting to you absolutely would not have happened. Statisticians are amazing, and I appreciate them every day. So again, to acknowledge the Institute for Work and Health, my employer, as well as the Partnership for Work, Health and Safety, where I'm posted, and CIHR. So we're here today to talk about heat illness. And heat illness is not a condition like cancer where when you hear the term, you necessarily automatically know what it means. It includes a whole set of conditions, from those that are not so severe, like let's say you get a little bit more irritable when the temperature goes up where you are, to those that are much more severe. So a heat illness of any kind happens when the temperature and the heat around you and the heat that you're producing, your metabolic heat, that heat source combined exudes your body's ability to maintain its internal temperature. It becomes overwhelmed by heat. And as it becomes increasingly overwhelmed, more problems happen for your body. So as temperature increases for you, maybe you start to lose your judgment. You can probably think of a soccer game you may have played as a child when you got really hot. You didn't feel so great. And for workers, even at a lower level of heat illness, we can be concerned about loss of judgment. Usual safety behaviors that may be there may be less pronounced as the body heats up. Further, as things get more concerning, there can be skin disorders. Your body can start to erupt in rashes because of all the sweating that's going on. And as things become more severe, you can succumb to heat syncope, which is a very fancy way to say you're going to pass out. You might faint. And this happens because your body is putting all its blood out to its surfaces so that it can help cool it down. And when it does that, the blood leaves the brain. And when the blood leaves the brain, you fall over and you faint. Heat cramps happen because the body is giving out so much sweat. And when it gives out sweat, it gives out salt. And when it gives out salt, our muscles aren't so happy. So as you're sweating, and sweating is good, sweating helps you cool down. But as you sweat further, your body can start to experience heat exhaustion. So you might feel nauseous. You might pass out. Other things might start to happen. And your core temperature starts to increase. You start to get almost like a fever, like what your mom would have been concerned about you having, let's say when you were 7 and you had the flu. Except now it's not because of an infection, it's because your body is overwhelmed by heat from your environment or from your body's core. And heat stroke is the most concerning heat illness. And when heat stroke happens, it means your body can't sweat anymore. It doesn't have any more fluids. It doesn't have that ability to help you cool down. And when you have heat stroke, there can be damage to your internal organs, your heart, your liver, your kidneys, and they do important stuff. And when there's damage to those, you can die. So heat illness, full range, some less concerning, some much more concerning. It's a full range. So what's your perspective? On a scale of 1 to 10, how concerning is the issue of heat illness in the workplace? So you think of, let's say, a rating of 7 to 10, meaning that heat stress is really concerning for all workplaces. And a lower rating, meaning it's not so concerning. And I'm not going to ask you to raise your hands and vote. I'm not going to ask you to do that today. But I did ask another group of people to do that. I asked the group of industrial hygienists in Ontario. And hygienists are the folks who advise workplaces when they have a question about a concern they have about the health of their workers. in Ontario, those are the people who are consulted. And they said to me, Melanie, this scale isn't useful. And I said, why, room of people I'm presenting to when I'm nervous? Is this question I'm asking you not useful? Ooh. And they said to me, Melanie, it's not useful because in some workplaces, this is a big, serious concern. So serious that it's probably an extremely frequent question when the temperature starts to go up. But if you looked at the average workplace in Ontario, this won't necessarily hit the radar of everybody. And that's why this rating is not useful. So I smiled. They were right. They were the experts. I was just the researcher. Who was I? And I also had been aware, there's another story I'm going to tell you about this, about the importance of heat illness in the workplace. And that is, it's a tragic story, actually. It happened, there have been 3 deaths in Ontario by workers over the past 15 years or so because of heat stress, specifically in Ontario. And one story was of a man who was about 44, and he worked at a bakery. And one day he started vomiting, he went unconscious, and he actually died. And this was about 2001, so a little while ago. And as the Ministry of Labour put together its report and looked into what happened, they had this to say. I learned that the workplace had an air-conditioned room where he could have gone for breaks, but he wasn't allowed to use it because he wasn't a manager. He was just an employee. Someone else who was there, a director at the Auto Workers Union, said, this is certainly a preventable and predictable death. He had so many symptoms before he actually collapsed. Why did nothing happen here? So heat illness isn't necessarily always a story we're concerned about with the whole population, but for those who experience it, it's a big one. So here's something I started to think about as I began this project. As I began this project, public health was quite concerned about heat and health, rightfully so. There was a lot of information coming out to explain to us that as climate change was occurring, on average, our environments were going to get hotter. And not only on average were they going to get hotter, our extremes were going to get hotter, which means that we're more likely to have problems because of the heat. So public health is all on board about this. There's programming coming out. I was working for Environment Canada at the time and was quite aware of initiatives, and these were awesome. And at the time, I was approached by a senior scientist with the Institute for Work and Health, and he said, Melanie, what would you like to do research on? And we arrived at the topic of occupational heat stress, because at that time, those in public health were concerned about heat, and they were rightfully concerned for it about workers. But they didn't know very much about what happened with workers in the workplace, and specifically in Canada. At the time, there had been no studies of workplaces, of industries, of the population in Canada regarding heat stress in occupational settings. There had been some elsewhere. So nearby us in Washington State, there had been some work, there had been some in Italy, but not in Canada. And the thing with heat stress and temperature-related and just generally weather-related incidents and morbidity and mortality, they tend to have geographic patterns because the weather isn't the same here as it is in these places. Also, there's a different occupational mix. The industries that are more predominant in some of these locations may not be the same industries, in fact are not, that we have in the location I was interested in. The studies that have been conducted also weren't always looking at the full population. Instead, they'd be focused on specific industries, like the military or agriculture workers. Further, it was largely descriptive. They would largely tell us about the kinds of workers who were affected and were not affected by heat stress. There wasn't a lot of information about the risk that came with various environmental exposures. And lastly, which was a piece that I was most interested in, there was no comparison. We didn't have a lot of understanding about how is heat stress experienced in an occupational setting? What about in a non-occupational setting? When public health thinks about workers as vulnerable, are they correct? Do workers, in fact, experience increased risk at higher temperatures than the average Ontarian would? They didn't have any data on this. And so this was where we started to roll up our sleeves. So today what I'm going to do is I'm going to take you through what I call the 5 W's of heat stress in Ontario. We're going to talk about who is commonly affected by heat stress, what is the general rate, Where is this happening? When does this happen? And my personal favorite as an epidemiologist, why? What's associated with? What do we see? So starting off with what? And here, I was working with two population-based data sets. I was working with emergency department visits, and I had emergency department visits over 7 years. And for each time someone came into the emergency room, we had information about whether the clinician thought this person was coming in because of a work-related condition or because of a condition that generally the taxpayers of Ontario should pay for under our public health, our health insurance program. So we had that distinction of work-related and non-work-related, which is fantastic. The other data set we had to work with is from our equivalent of WorkSafe BC. So in Ontario, it's called the Workplace Safety and Insurance Board. And from this organization, we had lost time claim data. And a lost time claim is filed when a worker succumbs to a work-related injury that requires them to take the next day off work. So it's not that I get sick today, I go home, and then tomorrow I might come back to work. That would be a non-lost time claim. A lost time claim would happen if I get sick today and tomorrow I'm still not feeling better and I have to take a full day off work. That's when a lost time claim would be filed. So we have these two population-based data sets. And what we were able to do is, thanks to coding that happened in each of those data sets about the type, the reason why the person came to the emergency department, or the reason why the person filed that claim, I was able to pull out whether the reason was heat-related. And we did that not just by the first reason they were there, but we looked at the second reason why the clinician said they were there, and the third reason and the fourth reason. And this is really good. This gives us a great understanding, because sometimes someone might come in, they say, oh, he fell. And then they say, as the second or the third reason, oh, he fell because he fell over because of a heat illness. So it may be that it's not listed as the primary reason someone comes into the emergency room visit or someone files a compensation claim. So this was important. So how frequent was it? So we had 7 years of data. We have a province of workers. So there's 3 times as many employed people in Ontario as there are in BC. So it's much larger. And over those 7 years, there were just under 800 emergency room visits that were work-related and were attested to be because of heat illness. And we had just over 600 lost time claims then. So again, we hear stories similar to what the industrial hygienist told me when they said, Melanie, this doesn't happen to everybody. This isn't the #1 most frequent condition that happens in the workplace by any means, but it's certainly happening. And overall, when you look at the rate of this, for both lost time claims and emergency room visits, we're talking about 2 cases of heat illness per 100,000 workers annually. But what we know, and what we think about in public health typically, is they always tell me, Melanie, it's just the tip of the iceberg. This is what we can measure, and this is what we can capture with the data sets we have. So really, what we don't know is what we don't know, literally. So what about the non-lost time claims? We weren't able to capture heat illness there. What if a worker didn't go to the emergency department, but instead they went to see their family doctor, and they didn't end up filing a claim? They don't enter our surveillance that we have at the moment. And lastly, what if someone didn't fully have heat illness so much that they needed to go to the doctor, but instead they just had a really rough day because it was so hot, and they had to sit out, and they had to drink more water, and maybe they couldn't work to their full capacity that day. So these cases and these rates, as we understand them, are useful and important, but it's also important to remember that we're not capturing all heat illness that we know is likely happening in Ontario. So next off, who is affected? And here, again, we're going to look at demographics. So think of older people, younger people, males, females, and we're also going to look at worker characteristics and the characteristics of where these people were working at the time of their injury. So first off, men and women. And here I'm actually going to ask your participation. So who thinks that females were more affected? Who thinks that males were more affected? Okay, so there were more votes in the room that men were more frequently affected by heat stress. And that is in fact correct. So by about 2 times, the rate was greater in men than in women in the workplace. And what about age group? So is it younger or older workers who are succumbing to heat stress? So younger, okay, we got a decent vote here, and older. This is interesting. So we have about a split in the room on the perspective here of whether it's younger or older people, workers who are affected by heat stress. Here's what we know. So those 15 to 24, 25 to 34, 35 to 44, 45 to 54, and 55 to 64. And these are rates. So in fact, it is younger people who are more vulnerable to heat stress than older people. Interesting. And so you might then be interested, well, what about if you look at both age and sex? Then what do we see? And do we tell a different story if we look at the emergency department than if we look at compensation claims that are coming through? And generally, if you squint at these, you see the same pattern in both the graph on the left and the graph on the right. So you see in both that it is younger men. So this dark blue bar here, those are our males, who are having the highest rate of heat stress. Now what's interesting though is that this pattern is less pronounced, this age difference, as well as the difference between men and women when we look at the rate of lost time compensation claims and emergency department visits. And you may have some reasons popping into your head as you think about why this might be. You might be thinking, well, maybe it's because the young gents who are affected can go back to work the next day. It doesn't fully knock them out and affect them so badly that they can't go back to work today. They can recover more quickly. So they don't qualify to file for a lost time claim. It may also be the case that younger workers simply are very unaware of what their abilities are and what they can go for as a new worker in that workplace. Maybe they don't know they can file for a compensation claim. So it may be, because these are of course accepted compensation claims, we don't know what proportion, we don't have linked data sets to figure out how many people here then filed for a lost time compensation claim. All right, now the worker characteristics. So we were able to pull, of all the lost time claims, occupational characteristics. And these were those at the individual worker level. So using the National Occupational Classification, we could boil this down to 3 categories. Are you a manual worker? Are you a non-manual worker? So this would be me. I would be a non-manual worker. Or do you have both manual and non-manual aspects to your job? And we looked at, for all the lost time claims for heat, where do these fall? And what we see is that most of the lost time claims being filed for heat illness are filed by those who have manual occupations. This makes sense. If your body is producing a high load of metabolic heat, you're more likely to succumb to that. And we also see here that those who have both manual and non-manual aspects are also having a higher proportion than those who are non-manual only. And this is useful. We're looking at burden here. So of all those filed, where do they fall? What we also wanted to know is some people who were very smart said to me, but Melanie, many manual workers have injuries. In fact, that's where we see most injuries happening in the workplace. This is a pattern that's normal and what we would expect for other illnesses as well. So what we did was we compared the proportion across these 3 categories for heat illness to those for all injuries that happen in the workplace. And this is a tool called the proportionate morbidity ratio. And what we see is that, yes, manual workers generally have more injury and illness than non-manual for all conditions. But even if you take that out, there are still a greater proportion of heat injuries happening amongst manual workers than we would expect for other conditions as well. So the next thing we wanted to look at was tenure. So we know with heat that your body acclimatizes. So within about 5 to 10 days of being in a hot environment, our bodies figure stuff out. So we're then, after being exposed for a longer period of time, we sweat at a lower temperature. And this happens over a shorter time period. So we had reason to think that workers who were newer to the job would be more vulnerable to heat stress. And when you look at the proportion of when these happen, again, this is burden, we see that the majority of cases are still happening when a worker has been in the workplace for over a year. So this tells us that yes, it may be the case that there is a higher rate, which we're not looking at here, of heat illness happening amongst those who are newer, but still the majority are happening amongst those who have been in the workplace for a decent period of time. And if we use a proportionate morbidity ratio trick, again, thinking to ourselves, well, maybe workers who are newer are always more vulnerable to all illnesses, not just heat stress. And we think about that, and we take that part out, we still see that there are 2 times more proportionately heat illnesses experienced by those who've been in the workforce for less than a month than those who've been there longer. And this peters out at about the 3-month mark. So we know that there are more injuries happening in those who are newer. And the other thing people were interested in is saying, well, what industry are these workers a part of? Which industries should we be targeting if we were going to take on prevention initiatives? And here's the breakdown. So we see manufacturing sectors have the greatest proportion of lost time claims being filed. And this we can logic through by saying, well, manufacturing has an abundance of manual labor going on. It may also have less air conditioning and temperature control going on there. So government service came up as another big one. This is a very broad category. If you are a garbage collector, if you are a fireman, if you are a tree planter working for the government, you will fall into this category. So construction as well. And when we consider as well the proportion we might expect anyways, but proportions are greater because of heat, we see the categories switch around a bit. So now governmental service, we know that there are an excessive number of heat lost time claims being filed there than we would expect, as well as agriculture, construction, and there are some others as well. And this last one here I'm showing you is one that I found most interesting and I think really helps us get to the bottom of things. So luckily for us, it seems that if some other really smart people and another sector of the government have gone in and classified occupations and thought about the locations where these workers would be and the conditions they would be working in commonly. So they would look at what is the most frequent location, what is the most frequent environment they would be in. So they would say, okay, does the location include fire, steam, or hot surfaces? So here you think about people working, let's say in a restaurant facility, somewhere where there's heat because of food that's being made. You think of our firefighters and those who are dealing with flames to extinguish them, as well as those in some manufacturing sectors where there may be steam, fire, hot surfaces. The other category that's quite useful is they categorized whether there was outdoor work involved. And this is quite useful because we saw earlier that those in agriculture had more heat claims than we would expect. And the other category that was quite interesting to me was whether or not the worker's occupation lacked a temperature-controlled space. So in fact, if you were an outdoor worker and you worked outside all the time, you didn't have access to air conditioning, you would also fall under this category. If you worked in a manufacturing facility where, again, there was no air conditioning you could use, you would fall under this category. All right, so if we look at the breakdown here, we see that the majority of lost time claims were being filed by people who identified their occupation suggested that they were outdoor workers. And we saw about a quarter of those workers lacked a temperature-controlled indoor space. And when we look at how these proportions compare to what we would see for all injuries that would happen across, we notice that for each of these, there is a heightened proportion of heat injuries than we would otherwise expect. So that's our who. Then we started to look at when. And this is interesting because, again, a lot of campaigns for prevention for heat stress are seasonal. They're not running campaigns to say, hey, workers, don't worry, make sure you don't succumb to heat stress in February, because they assume that the risk is not as great, that in months where it's colder, they don't see heat stress conditions. And so the months when I predicted, we would see higher rates of heat stress were the summer months when it's hotter outside. And then the other curious thing, though, is to think to yourself, okay, we'll take months like May and September. They probably have a similar average temperature. It's maybe about 17 degrees average in Ontario, maybe 20 degrees. They're quite similar for both of these. And here's what we see. We see that, as people expect, in the winter months and when it's quite cold, there are very low rates of heat stress in the workplace relative to the warmer months. We expected that. The interesting part for me was to compare rates in May to September. In May, it's starting to get hot. We've been used to it being very cold. We are not accustomed to warmer temperatures. So even though these may in fact have absolute temperatures that are similar, our bodies may react to them differently because we're not used to those experiences. The other thing people asked me about, they said, because people commonly say, the summer actually that I was doing this work was 2011. When I was doing the work, it was a really hot summer. People kept saying to me, oh, well, do you have data from this year? And I would say, no, our services aren't quite that fast. They're big data sets, and that's not how data comes through. And they said, well, that's too bad, because I bet you'd see a lot of cases this year that you might not normally see in other years. And I said, well, that's interesting. Is the annual rate of heat stress always the same, or do we see variation year to year? And we do, in fact, see variation year to year. So this is indicating the rate of emergency room visits and lost time claims for heat across different years. So we see in Ontario 2010, 2006, and 2005 had heightened rates of heat stress relative to the other years we were considering. So yeah, there is annual variation. It's important to consider. And the third and final thing I was interested in when I thought about when was, does heat illness happen every day, even within the summer? Is this something we always have to be concerned about? Or are there some days where this happens more than others? Is there a concentration of heat illness over some days? So what I did is this line here represents all the days in the study period. So this represents, this length is about 2,555 days. And if we were to take this length and represent the number of days where there was an emergency department visit, this is the size. So on 12% of days, there was an emergency department visit for heat illness. So this doesn't happen every day. Further, we saw a similar pattern when we looked at lost time claims. Again, this doesn't happen every day. 11% of days had a lost time claim injury. And if you do the math in your head, you also realize that this can't mean every day of summer had one either, because more than 10% of our days involve summer temperatures. So we looked at even further, and this blew me out of the water when I realized what was happening. So about 10% of all emergency department visits over the 7 years of the study happened on 2 days. 2 days of the 2,555 days. And those 2 days were in August, and they were adjacent to one another. And we saw a similar trend when we looked at lost time claim injuries. So this dramatic clustering on some days over others. And this also caused me to think, well, is it possible, because we know that these 2 days were adjacent, is it possible that heat illnesses are clustering? They're clustering over time adjacent to one another. So then we could say to policymakers, hey, if there are emergency department visits happening for heat today, there's probably going to be some tomorrow, or there was probably some yesterday too. And it turns out that 55%, so over half of emergency department visits were in a cluster. It means that either the day before or the day after also had a heat-related injury coming into the emergency department. And again, we saw more clustering with our lost time claim injuries. Cool, eh? So we think about by month, by year, and by day. We see temporal patterns. And now the other beast is where. Ontario is big. All of our provinces are big. And within these big provinces, again, we have people running prevention programs who are saying, well, where should we put our money? Where should we go and try to prevent these injuries? This is actually a picture of my sister, who is on a forest firefighting crew way up in the north of Ontario. This is a hot day. She's in full protective gear. You can see she has a water bottle in her back. She's spraying water. But this is a physically active job. She's a young person, And she's not where most workers are either. She's not in Toronto. So it's interesting. People have said to me, well, Melanie, you're going to see it in cities. Because in cities, that's where we have heat island effects and where it's hotter if you look at the whole province. And then other people said to me, no, Melanie, you won't see it in cities. That's not where it'll be happening. It'll be happening rurally, where we have workers who look like my sister Laura. And those second people were right. So Toronto, for those of you who don't know, it's right about here. And I'm pointing right now to the light area just above Lake Ontario. Yeah? Aha, wonderful. The beauty of technology. This is Toronto. So what we see, the lighter colors here represent census divisions that have lower rates of heat stress. And those that are darker red indicate that there are higher rates of heat stress. So when you look at this, your eye tells you a couple things. One, it says the colors are not random. It seems like colors that are similar are beside each other. And when your eyes tell you that, they're right. When we use statistics, it tells us that this spatial pattern is not random. We have clustering happen, where heat illness rates are happening to be higher in some areas more so than in others. So in southwestern Ontario, down here, we see the census division with the highest rate of heat-related emergency room visits happening. And the other area we see especially high rates is in northeastern Ontario, which is where my sister happened to be that day. Not necessarily in cities and where necessarily we have the majority of workers. The other thing I'll mention for those of you who are less familiar with work in Ontario, the southwestern area has an abundance of agriculture. So again, outdoor workers, which based on what we know about the WHO, could suggest that these might be those who are affected. And in northern areas, there are far more active workers, manufacturing, etc. And now we're approaching my final and favorite question, why? So I had three purposes here when I asked this question. The first was to understand what is the association between weather patterns and emergency department visits. My second was to compare whether we saw greater associations with temperature or with the humidex. Does everybody know what the humidex is? Yeah, I'm seeing nods in the audience here. It's a composite measure that people use to try to get at how temperature feels to us as people. So it considers both humidity, a measure of humidity, and temperature in a composite measure. And it was developed years ago, back in the 50s, by some meteorologists and researchers at Environment Canada. It's an old one, though. It's still one that's used commonly when they think about workers. And the third question was whether we saw differences if we looked at occupational and non-occupational heat illnesses. I'm going to take us through quickly here. So we were looking in southwestern Ontario, which is the blackened region at the bottom. We were focusing on adults who were working age, looking at heat illness had we had previously. There were about 300 cases there of work and about over 1,000 of non-work related heat illness. We looked at exposure with mean conditions of weather throughout the region, and we considered temperature as a continuous exposure and a bilinear one. Our analytic methods were advanced, which meant we were able to control for temporal patterns as well as for other confounding issues. And here's what we see. What we see is that the rate, the average rate, increases to almost 500 times at high temperatures relative to what it might be at more moderate temperatures. This is very, very dramatic. These relative rates are quite remarkable. The other thing we see is that the increase in rate begins not only at the very high levels, but even at moderate temperatures. So here, if we look at just for degrees above a threshold of about when we saw that change, when it hit 1, so at about 14 degrees Celsius, we see that per degree increase in temperature, there's a 55% increase in risk, increase in the rate of heat stress. That's dramatic, 55% per degree. Huge, 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 huge. And we adjusted, as you can see, for a whole bunch of other stuff, including air pollutants. There's other trends that we pulled out of this, so we're pretty confident we're truly measuring the effect of temperature here. When we look at humidex, we see less pronounced associations. So we're seeing 25 per degree here, where before we saw 55. Other thing too we noticed about this model is that it was less likely compared to the temperature model, which suggests that temperature, considering these other characteristics separately, can be more accurate and correlated with risk than Humidex. When we look at workers compared to non-workers, this is what we see. So here are non-occupational groups. We see statistically significant differences in risk for those who are working and those who are not working. Very dramatic. So almost 2 times as much risk per degree for occupational heat stress than non-occupational. And this is the overall continuous version. I'll just flip back and forth between that of working and that non-working, and you see the dramatic trend. All right, so to finish up, heat illness is an issue for the Ontario workforce. It clusters in mini epidemics, I've called them. Cases don't just happen in the south of Ontario where it's hotter. We see increases in risk, we also see the moderate temperatures, not just when it's really hot, and workers' risk increases more dramatically than non-workers. And for the policy folks we've spoken to, we've been explaining that surveillance and prevention for this can be improved. There should be a focus on those who are vulnerable, and that prone workers, workplaces, and industries should consider prevention strategies. We've talked about how the Humidex may be a less ideal measure than others, and that occupational heat stress relative to public health concerns, those who are thinking about public health should also think about this. That's the end. Thank you both.
Melanie? I'm actually going to start with a couple of online questions here because they've been rolling in. The first one is, oh, this is such a narrow window, it's hard, they get lost. It was a question about young men being at higher risk. It's likely that young workers and male workers are more commonly assigned to tasks that are heat prone. And that workers with less than 1 year of employment are far less something that I can't read anymore. Anyhow, can you comment on that potential source of confounding?
Certainly, I agree with that. So the statistics that I showed earlier were those that are descriptive. So they're not, as this person has observed, pulling out those confounding issues. We looked at gender separately when we looked at other characteristics like industry or occupation. So I agree absolutely with this observation that it's likely the case that this is confounded by other factors we're also concerned about. When you look at all the workers, whether they're men or women or young or old, you can bet at that point it's going to be men and those who are younger who are succumbing more frequently.
And then a second one, there was a question about May being relatively high in terms of the temporal trend. Mm-hmm. And is that simply because it's the first hot month of the year, or?
That's my hunch, is that especially compared to September, it's the first time we're getting used to that temperature compared to earlier. So often in May, which I always find really funny, you see people running around in shorts. But you would never see that in September with the same temperatures going on. And it's because our bodies at that later point are adjusted and used to heat.
Thanks very much. Always educational to hear you talk about this. I learn something new every time. On that same topic, so do we know physiologically there is this adaptation and everybody goes through that, or is this a Canadian thing with temperature fluctuations and we revisit it every year, so every May we go through this? We have to adapt physiologically to the increase, and once adapted over the summer it starts to, in September it drops off and then we have to build that up again. Is that the way it kind of works?
It's certainly right. And the other thing that's interesting about Canada specifically, since you mention it, is that, see, my other sister's living in Colombia right now, and it's stinking hot every day. Whereas here in Canada, we get variations, not just month to month, but day to day. And so it may be harder for us as Canadians to adapt when we see these variations in temperature. Because if we keep in mind that it's about 5 to 10 days of being in an environment to adapt, let's say you go on vacation, and you're going on vacation in the summer, which means that you can actually take like 2 weeks off. And when you come back, if you're in an especially hot workplace, you will no longer be adapted to those conditions if you start right off thinking that your body will be able to handle the heat the way it normally does. Yeah.
We have another question online about why the preference for Humidex over dew point temperature.
Neat. So I chose to incorporate Humidex into the model as I did, because at that point in time, it was purported quite frequently as being useful for workers. So that's why I used Humidex over others such as dew point temperature, which are a more specific measure of humidity perhaps that is not as commonly purported by the media and others who are talking about workers and risk.
Thanks for an interesting talk, Melanie. Just a question in your lit searches. Did you do any comparisons with other countries such as Europe and more recently in Australia where they had bouts of extreme heat events? And did their data bear out or your data bear out similarities with theirs?
I wish I could. The tricky part is that occupational heat stress is not frequently studied. Frequently, there will be studies which are great about public health and how populations in Australia, in Europe, in Canada react to heat. But it's rare for someone to focus on workers when they look at these. The studies that I have found have been in the States. And when I compare our industries where we see peaks to industries where they see peaks, they're generally similar. When I overall try to compare rates, which is hard because the measures that I have won't be the same as the measures they have because we have different populations and means of identifying a lost time frame. What does that mean in Ontario? What does that mean in this other area I'm looking at? Those aren't necessarily the same. But when I do try to adjust and make my best guess at how similar we are, we see higher rates of heat stress in Ontario than we do in states close to Ontario in the US. Go for it.
I picked up your point about suggestion of making more efforts and looking at vulnerable populations. And I know that you say that male young workers seem to be more at risk. Thinking about female working populations, such as those who are pregnant or even male or female with chronic health conditions coming in. How realistic do you think would policy efforts be implementable in the workplace?
That's a really interesting question. I think that if you're trying to go biggest bang for your buck as a policymaker and putting money somewhere to try to prevent heat illness in the workplace, we see it happen most commonly amongst males who are younger. This doesn't mean it isn't happening for females, and it certainly doesn't mean it's not happening for older people. When you look at a population level, they're often more concerned about the elderly and those who are very young in our overall population because those extremes have less ability to control their body's internal temperature and react to the environmental conditions. So especially for those, as you're saying, who have chronic illness and who are older, I would be very concerned. I think one reason we perhaps see less of those coming up in our data is because perhaps those workers are no longer working as actively. They're not perhaps in those manual jobs. Maybe those workers are now more likely to be managers or to have self-selected away from conditions where they physically have a harder time than they once would have.
If there's no more questions, I will remind everybody that next week is reading week, so we do not have a seminar, and we'll let you start your reading week 15 minutes early. Have a great time, everybody. Thank you, Melanie.